Happy Nursing Week, everybody. And thank you so much, Mitzie, for wanting to join on this year-to-year event with the modified, modernized, eco-wise version. This is Take Your MPP to Work Eco 19 version. And we want to just say thank you very much to our colleagues at St. Elizabeth for joining us, for shining the light, not only during COVID-19, but always, and for pushing the agendas that need to be pushed. And together, as the saying goes, together we can do it, not only in terms of going through this difficult period, also though on making the system better in the go forward, because it needs to become a system. We talk too much about the health system, but really with all due respect, because we do need strong hospitals, a system cannot be anchored in hospital care. People live in the communities. So with that, let me say Happy Nursing Week and ask Angela to bring a few remarks from the board, from all of us, about living in the community. That is something that Angela always says also. So thank you.
Good afternoon, and I want to wish you at St. Elizabeth Health Center, Healthcare, and all the nurses in Ontario a happy Nurses Week on behalf of RNAO and the members of our board. We acknowledge who you are and what you have contributed to the healthcare system and to patients. We applaud you for being diligent and compassionate, providing culturally competent care in a very comprehensive way. You focus on the client and you meet the client's needs from day to day. And for your work during the pandemic, we really appreciate what you've done and what you'll continue to do. And we applaud the politicians who join us, MPP. Hunter, we thank you for attending today. And yesterday we had the Prime Minister. So we have many members of the Parliament, Provincial Parliament. And this morning we had Minister Maroney. So I am trying to send tweets around all these people who have attended, Take Your MPP to Work. But we really appreciate you. We appreciate our nurses, and I say God bless you.
Thank you very much, Angela.
Shirley, I think you're on net.
Mm-hmm. Ready to go. Thanks, Imogene. And hello and welcome. I'm Shirley Sharkey, the CEO of SE Health, that 110 years ago was called St. Elizabeth Visiting Nurses Association of Ontario. So I think we have modernized the name to SE Health and made it easier for everyone to describe. I always love Nursing Week because I'm not only a proud CEO of this organization, but I am a nurse. And it's funny, someone texted me the other day and they said, are you a nurse or are you a CEO? And I said, well, I'm both. And actually you can't be a CEO unless you are a nurse. Isn't that it? And it was really interesting where they kind of came, you know, I thought, oh, I'll just twist.
I like that.
I do too.
But we're also and have been a very sort of proud supporter of RNAO in many, many ways. And Doris and Angela have, especially during this time, been extremely, no surprise to me, extremely helpful to recognize the vulnerable, to recognize where there are gaps in the system, and to continue to push the kinds of changes that are needed so that we take care of people in the community. And in particular in home care, where probably with the pandemic, as has really played out in most countries other than Spain. And of course, Doris has done an amazing job on a whole really analysis of what's going on with the pandemic in other countries, where Spain right from the get-go realized primary care and home care were going to be absolute anchors as we go through this pandemic. And that's not to say that the hospitals and long-term care are not also important, but if we forget where people live And in fact, where we're going to have to be for many months, it's really critical that we continue to make sure we have a system that is strong and robust. And I'll be honest, we've had some challenges in the last couple of months, but that would take the whole program, so we're not going to go into that. I have I'm so proud. They're like my kids, even though you're much older than that, to be my children. But Felicia is on, Jill is on, and Cayenne, and of course Madonna. Not being a nurse, I keep thinking you are a nurse anyway. We work so closely together, you may as well be one. But these are amazing stars and heroes, in not only for SE Health, but for nurses, for community, and for the vulnerable. And you're going to hear their stories. So I'm gonna stop, but I can't tell you how appreciative I am that SE Health has such amazing champions. And also at this moment in time, they've really rallied to the needs in not only home care, but long-term care and retirement homes. And we've provided, and I think with the help of BPSOs and best practice guidelines, some real depth to very good infection control and making sure that people have safe and quality care in the community at this point in time. And I think being a pioneer in the area of best practice guidelines helped us quickly ramp up to provide the right care for people. And Jillian's been keen with that, and Cayenne has also been keen. And Felicia is close to my heart with our homeless program, and she'll speak to that too. So I'll stop there. And as I just say, it's a thrill to be here. And I can't say enough for the help and support RNAO has provided at this time. And I mean that in the most serious way. They've been on my call when I've been a little hysterical sometimes with PPE and other things, and Doris has been right there. So thank you, Doris.
A pleasure, and always a pleasure.
And I must say, Ermagine, every night I enjoy watching you. Every night I go, let me see what color shoe she's got on this evening.
But I must say I enjoy her. I enjoy even more Mike when Mike speaks.
You're my therapy every night when I watch you. So kudos, thank you for that. You're on mute. You're on mute.
Going to say, Mitzie, my husband and I every night do a cheer, and we're all alone in our neighborhood. No one has yet joined us, which isn't a good thing, I realize. However, we've taken to social media, so we do have a bit of a following. And my husband is much shorter, which is why I think he's liked his words. Anyway, so now, Mitzie, we want to give you an opportunity to say a few words of greeting. And first of all, we want to say how grateful we are to you to have joined us today to see what is happening in home care in particular at this time, and in relation to vulnerable populations. And I believe we're able to showcase some of the work being done within your riding. So we'll turn it over to you now, Mitzie, and thank you again for joining us.
Thank you so much for this wonderful opportunity. And it is Nursing Week. And I want to just say how thrilled I am to be here with you. Thank you, Doris. Doris always just sets me straight where whatever I need to know, she'll tell me. So I just thank you.
With respect, because you ask, you know, not every politician asks, and you are a fantastic politician that asks and wants to hear.
Yeah, and maybe because I have not always been a politician. I've been elected now for 7 years, and before that I was the CEO of Civic Action, which was all about collaboration and really always having the stance that it's all of us around the table that have collective answers, not individuals. So that's just the way that I think and the way that I am. And you know, the work that nurses do in all aspects of care is something that I very deeply respect. I thank you, Angela, for your leadership and the work that I see each and every day in my community. I have a personal story. My one of my favorite individuals is one of my aunts who is a nurse, and she lives in my riding. So whenever I do campaigning, and campaigning is really hard, like you wear out shoes actually when you campaign, and I've done it 3 times, and 4th if you include the last leadership. But whenever I need a respite, I go to her home, and there's something about the hands that are so warm, and I always leave feeling better. And she always just knows the right thing, whether it's a cup of tea or go take a nap in her bed. Like that's the generosity that I see in nursing care. It's really all about what you need, and it's provided so that you can live better and live well. And so I remain a supporter, and I know that there are many answers that we need. I've spent time, a lot of deep thinking about retirement and aging, because I was the former minister responsible for the pension reform in Ontario. And one of the things that I know in Canada and in Ontario is that we are aging. And we have to have solutions that are meeting the needs of the population. And one of those solutions is how we care for people who are aging in the place in which they live. And that's something that that we would look to you for solutions for that. And I would also say, in this moment, we are in a health crisis. And the only thing that allows us to feel secure are the people who are on the front lines of healthcare. And there's an attitude that I notice when I interact, is that it's almost as if you're absorbing the impact of this crisis so that the rest of us can carry on. And therefore, someone needs to have your back. And I believe that has to be a role that governments play in the decisions that we make to safeguard your profession and to make sure that you have what you need. When you speak and you tell us, we have to listen because you're on the front lines. So I want to say thank you. And I do see some younger faces looking back at me who have chosen this profession. And you are in it at a very special time because you have an opportunity to shape it for the future. There's nothing that we've ever weathered in our history where nurses have not really been the ones to protect us, really, right? So here you are again, and I believe that you can shape the profession for the future. And I'm here to listen and to observe, and I thank you for organizing this virtual tour for me.
That's beautiful. Thank you, Mitzie.
I'm wondering, Mitzie, we at SE Health in February created a great book called The Future of Aging. Mm-hmm. And actually it talks about, from a very different, a strength-based approach of both what exists now for seniors and how things could change for a much more positive future of aging. We'll make sure we get a copy out to you because we had our book launch. It seems like 25 years ago, it was just in February that we had the book launch. But I think you'd find it very interesting to look at what is kind of an inspirational way to look at the future of aging versus how sometimes it's depicted with all of its challenges. So it was created with another company called Idea Couture. And it was a real journey for all of us at SE Health to put it together. But we'll make sure we send one out. And I don't know, Doris and Angela, if we have.
Send to us. We will send you our address at home.
Okay, perfect. I
would love to have a copy.
Be happy to do that.
Signed. We want a signed copy.
Oh, okay. We'll do that. We'll all be movie stars after this.
And I also, for Irma, I want to know where I can see the inspirational evening dances. Like, inspiration is needed right now. So where
you girl go to your Twitter,
yeah.
and when you do search, do hashtag together we can do it, and you are going to see so many of them, because that's what I do in the evening also, by the way.
Oh, so you retweet it.
And I pick some to put in my report, but absolutely you will enjoy it. But then you need to practice. That means you get outside of your porch or on your wherever, and you go with the pot and pan or with cheers or with clapping, and you just cheer up healthcare workers. It's to cheer up all healthcare workers, nurses and others who are in the front lines of care.
Can I tell you, I did a conga line car parade last night with YouthLink in Scarborough. And I mean, I was moved to tears. It was an incredible organization. We passed, places like Providence and, even just places that I didn't know was providing care. And so we passed all these places, but when we passed the youth homeless shelter, these young people, youth, were standing at the corner with the pots and the pans.
That's what it is.
And they were banging. And I gotta tell you, to see homeless youth join in to thank our frontline and first responders, I was moved to tears.
Yeah.
Because that shows you that we're in this together.
Yeah.
No one is left out. Everyone is going to solve what we're facing together.
So today, Mitzie, is day 58 or 9. We started that back then because we wanted to just show that together we can do it, and to cheer up healthcare workers and other essential services. And at the time, we also said that there would be those days that we will bang the pots and pans to suffocate the anguish when we lose people. And during Nursing Week on May 12th, is the birth of Florence Nightingale. We did so many celebrations this week, but that week, we issued a report that my colleagues were speaking before, and in the afternoon, we recognized 3 top nurses on awards. And when I was in the evening resting to look at what had happened in the Together We Can Do It campaign, I actually became aware that we had just lost Brian Beatty that same days. So one of our own, Florence Nightingales, was taken away by COVID-19 that day. It's the only, and hopefully the only, RN that we have lost, but 9 healthcare workers, Mitzie, 7 PSWs, all in nursing homes, 1 environmental worker in a hospital, and then this RN also in a nursing home, and his family is devastated, needless to say, both his work family and his home family. So it's heavy, but together we can do it, because Brian would say keep going, and so would Florence. So I think we'll let now SE
Yes.
to do their show and tell, because I'm looking forward to hearing all of you.
Yeah. Kayan, take it away.
Okay, well, thank you so much. It was such a pleasure to be celebrating nursing during this special time in many ways. And thank you, Mitzie, for making the time for having this important sharing and celebrating, and sometimes with heavy hearts with the loss of our peers. Actually, Jill Brooke, our events practice leader, who has been a frontline lead driving practice excellence. In a moment, I'm going to ask her to share some of the work that we're doing. But I just want to share a quick heartwarming story just to really put some spotlight on home care. We had a client that in our Montreal, actually, so SE Health is a national scope, a social enterprise. So we have home care services also in Montreal. As we know, Quebec has been hit very, very hard. We had this client that, at ALS requires 24/7 care that was supported by her husband. And unfortunately, her husband was COVID positive, was hospitalized, and could no longer provide care. And then I think, also our client became COVID positive as well, but she was being discharged to home while her husband needed to remain at home. And because all of the requirement of 24/7 care, Jill had actually worked tirelessly with our manager located in Montreal and put put a plan together. We actually had to fast and furious dedicate 2 personal support workers that lived with this client 24/7. We had to make sure, this was early days when PPE were very, very tight. We had to make sure that we were shipping from all over our service delivery areas to make sure this client in Montreal would have sufficient sustainable supply of PPEs by our lived-in workers to look after 24/7 need of this particular client. And Jill is very instrumental making sure all the infection prevention control practices are in place. We have our manager, who's a nurse, is going to be regularly check in with the client, make sure the care plans were put in place. So it took us a week actually to connect, to put all of those things in place. And that is, if that could give you any indication of the work that we do to enable people receive safe care still at home in this challenging time. So with that, I'm going to pass it over to Jill. She can share with some of her own stories. Actually, she's become a movie star herself. We had made videos to demonstrate how to use continuum mask. She's got her husband, her daughter, who was all, one was the director and the cameraman, and the other was the voiceover. So you leave it with nurses and they make it happen. So there
we need that video too, so we can put it on the website.
Great.
Oh
dear. Jill did not know I was going to say that and really put her under the limelight. Okay, over to Jill.
It's all part of the knowledge translation piece, right? So thanks, Kyan. Yeah, so I just wanted to share with you a little bit about what our approach has been to really ensuring that safe quality care happens during this COVID-19 pandemic, trying to make sure our staff are safe and protected and that they can provide great care and protect our clients too. So just going to talk a little bit about the evidence screeners, IPAC practices, the technology that we've used, and then of course the ultra important knowledge translation piece, right? So, as we all know with this pandemic, the evidence has changed rapidly. I would say day to day, but actually I would say sometimes hour by hour, we see new directives, we see new pieces of evidence. So we kept a really close eye on all that emerging evidence, all the updated directives. Doris and team, thank you so much for those RNAO reports that come out every day. Like, they're my lifeline. As soon as I get up, it's like the first thing that I read. I don't even think I get out of bed before I read that. So thank you so much for the work that you're doing on that.
Thank you. And there will be a piece, by the way, coming very soon on masks again, with several new pieces, which is important.
Good. Good. Thank you. I look forward to seeing that because, it's changing so rapidly. And so, what we did, we take all the information that you share, your team shares, the RNAO puts out, Public Health Ontario, everything. And then we use all that information to inform our approaches. So to client screening, IPAC practices, the use of personal protective equipment. We're leveraging technology and the exceptional talent that we have at SE Health to help build tools and dashboards that, you know, ultimately then the importance of that knowledge translation piece. So, you know, like everyone, we faced real challenges with the rapid nature of that evolution of evidence, you know, the expansion of the symptoms, and then the significant challenges that started to emerge with our congregate care settings that, you know, we've spoken a little bit about already today. You know, we reacted really quickly to that emerging evidence and the directives. We put the processes in place. And I would say at SE Health, we really have strived to not only meet meet the standards, but really exceed those standards to ensure that, you know, we're providing safe quality care. So, you know, we revised our client screeners, our employee screeners constantly. We collaborated with our community partners, you know, to validate the different versions, particularly, you know, sometimes we'd see maybe 2 or 3 versions, and then we'd have our LIN partners who would also share screeners with us. So, you know, taking all of that information and making those best decisions that we felt exceeded the standards to keep our populations safe. So in terms of IPAC, we developed practice resources based on the foundational principles of infection prevention and control, you know, RNAO documents, again, IPAC Canada, Public Health Ontario. There's so much information, and I think that's been one of the challenging things through these months is so much information and social media and media for our staff and our clients. So we wanted to really make sense of all the information to make it very clear for our staff and our clients, so that they knew that we were the place to go to get that kind of, or bring all that information together for them as well. So we, of course, created specific education and training and resources, like Kyan mentioned, videos, and you leveraging the videos and all of the great information that's already been provided to us. And so then PPE, you know, I'm sure you've all had multiple dreams and maybe it's nightmares about PPE. And so, of course, the challenges we faced, as everybody did, in terms of access to that PPE meant that we really had to work with the evidence that we had, the directives and information from RNAO and our other partners to implement really creative approaches to that mask use to protect our staff and our clients, and the best we could based on the limitations. And so we also, there was a lot of work done there behind the scenes with our talented technology folks, led by our digital transformation officer, developing digital client screeners and employee screeners to really provide data to drive decision-making through dashboard creation, and then the really exciting evolution of our virtual care capabilities, really enabling our ability to, you know, keep our clients at home as much as possible and be able to provide support to them virtually whenever that was appropriate. And of course, then, you know, none of this work is truly effective without that really solid knowledge translation piece. So strategies, we had have a multi-pronged approach, including access to online resources, implementing competency assessment strategies, team meetings, video creations, all of the other things that really would help facilitate that kind of knowledge translation, and working closely with our staff. And so, you know, we're currently continuing this intense focus. We're focusing on sustainability of practice, staffing congregate care settings, so important. You know, my heart aches when I read some of the stories, you know, in the media, in the press, and, you know, really trying to support our partners in congregate care. Doing organizational risk assessments and decision-making guidance to make sure that our staff that are helping out in these settings are not only feel safe and supported, but they're able to provide great resident care and safety for those residents as well. So that's through their IPAC practice assessments, ongoing audits with priorities on those settings that are, you know, already in outbreak, and continuing really to revise and implement our screeners and our tools and our virtual care processes to optimize this approach to care and to be able to, you know, give our clients the best experience that they can have. So
Thank you so much, Jill. That's fantastic. So thank you for that. And maybe we'll move along to, we know that our MPP Mitzie has also a very special passion for, I think just from what you've been sharing with us, the youth and the homeless population. Then maybe we'll move along to Felicia, our lead RN clinician and also our director of clinical director for our Journey Home Hospice. Over to you, Felicia. Thank you so much, Jill.
So thanks everybody for all the recognition for healthcare providers, sharing your experiences and the opportunity for us to be on this forum and speak from our hearts and share our experiences. I also, just like everybody else, want to thank all the frontline healthcare workers who devoted themselves to help society during this time. My prayers are certainly with everybody, all of you, particularly those who have lost their lives. So thanks for recognizing them. Hospice palliative care, I'm so happy to have this chance to share with you what we've been doing in our setting and for our populations. And just to echo a lot of what Jill said, we've been very, very fortunate to have such a robust team of clinicians within the organization to consult, collaborate, look at the data that's been sent to us from multiple different organizations, look at the trends, understand them, and incorporate best practices into our changing environment. I can't say enough that this is all teamwork and a team effort. I don't think we'd be able to implement anything without the assurance and support from the rest of the team, whether it be organizationally, the RNAO, public health, Ministry of Health, all the different supports available to us. I'd like to say provincially, we've been quite fortunate. So that being said, in hospice palliative care, from my experience, the skill of critical thinking is so important, especially as we receive new info day to day, and it's a lot of info we've been getting day to day. At our hospice, we've been leveraging technologies to enhance the hospice experience. Our staff have been participating in self-screening as well as screening patients electronically through the portals that have been offered to us within the organization. And those are being updated by our advanced practice leads and IT every day to ensure that we are following best practice standards and doing assessments as per the updates we receive from public health and the ministry. So at Journey Home Hospice, we started taking advantage of technology early on by piloting its use before the pandemic hit. We provided our residents with Google Home devices, which has come in handy now to offer music therapy. Each resident has an iPad in which we offer them support to connect virtually with their loved ones. Many of them don't have a lot of people connected to them, but the ones that did, we were really able to leverage that. We've been using a virtual app to conduct routine virtual rounds with our physician who hasn't been able to come on site for the safety of our residents, our staff, and just to really respect social distancing and keeping visits to ones that really are essential. So we've leveraged this technology as well, importantly, to meet with our teams, debrief with them, observe demonstration of safe practices of procedures, and also post resources for our staff and volunteers. We've even given virtual tours of our hospice and arranged virtual intake assessments. I've done a couple for patients that were looking to be admitted from hospital into our hospice. Our spiritual counselor has also been very accessible in providing virtual support to anyone who needs it. That's really been a godsend because we have multiple people that benefit from that service. Our staff were already mask fit tested. We had the appropriate PPE available for different situations, such as prevention of spreading any infection and managing patients on isolation or a potential outbreak. I think importantly, we've had organizational support and a strategy on how to access more resources in a timely manner in the event of an outbreak. We had sent communication to families early on around essential visits, what that might mean in their situation, the importance of limiting exposure to our staff and residents. We've had conversations with our staff, with our patients loved ones to minimize panic and anxiety during this time. That's become a really important reassurance to our patients who, when they're seeing staff implementing things like continual mask use, they're really understanding what that means, and we're finding ways to add fun into that, just to maintain that patient experience for them. We've had access to swab kits, connected with our local lab, created a process for conducting COVID testing and having the swabs processed. We've really actually strengthened our relationship with community resources, whether it be the lab, the pharmacy, and anybody involved with the hospice or could potentially be involved with the hospice.
So, Nisha, I was just wondering for Mitzie's information, I'm wondering if you could share this patient story just very quickly. That was highlighted in our CBC, I think way back when the hospice was first opened, just to give her more information about, you know, the homeless population, and particularly that young lady and who was going through end-of-life care with us. It always touched my heart in terms of what difference made for her while she went through end of life, and then the window, right? The window that's available in her room. So I wonder if you can maybe talk a little bit about that.
Sure.
Actually, before that, I do want to recognize, Mitzie, it was actually the prior government that recognized the need for a hospice for homeless population, and was incredibly supportive to us. That has allowed us to be where we are today. And just also to announce that we just got the city to provide us with a permit to expand from 4 beds to now 10 beds for the homeless population in palliative care. And it's a real shout out, because hospice care and palliative, and in particular homeless, we moved many miles ahead a few years ago, and we want to make sure that that continues forward. So I did want to make sure that we let you know we do remember people who plant the seeds for us to then allow us to really do what's so important for the homeless population in particular. So so Felicia, pleased with the story, but we believe me, we don't forget the wonderful champions that help us move forward with this, because without that, it's so difficult for us, even with fundraising and our foundation and so many other things, that it does take everyone to make this happen. And you were, and the Liberals were a strong link for this. So we have to recognize that. It's very important.
Thank you, Sharon.
I think I have actually another touching story, because I think, Kayan, the woman that you're referring to was before my time, but we have so many touching stories similar to that. And one that really I will never forget is we did have a gentleman that came to us from a nearby shelter. He had actually gone to Jamaica to start up a business, and he fell ill, and he wasn't able to get the supports that he needed back home. And so he had made plans to come back to get some good health care, be with his family. And when he came back, his family weren't able to deal with this illness. They didn't understand it. They were scared, and they didn't put him back in their home. And this left this man literally with nothing. And when I say nothing, family was everything to him. And so he, amidst trying to understand his illness, get updated care here in the city, he had no home to go to, no one to cry on their shoulder or deal with this experience. So he found his way into a shelter. Fortunately, he you know, with more information around his diagnosis, getting towards his goals of care, understanding that he wanted a place to call his home and be comfortable, we were able to take him into our hospice. One thing that was really meaningful to this man was that he wanted to be baptized. He had a couple nephrostomy tubes and he wasn't sure how to go about this. So we were able to connect to a priest, set up a couple meetings, talk to him about the baptism. More importantly, we sent one of our nurses with him. Once we arranged a location, we covered up his nephrostomy tubes, waterproofed them, and he was able to have a baptism where he was fully immersed. One of his family members did show up. He wasn't, I think what hurt us the most was he didn't have a confirmation of whether anybody would even show up. So, I mean, I had sent them the information and we were just hoping, you know, they got it. They'll decide, they know where to go. They showed up, but we sent our staff, of course, to be there with him because we knew what a sacred experience this was for him. And we knew how scared he was, not only about being alone, just about his health and being weak and traveling there. I think that piece, just to make that possible for him, it was literally his dying wish. And he couldn't stop talking about that really until the end. He and one of our volunteers wrote together, and our music therapist wrote some hymns together. They would sing them every morning for breakfast and until lunch. And he had such a beautiful voice, and he wrote these hymns down. It gets even better. But he was able to, we were able to help him plan his funeral because he wanted to make sure he was buried. So we were able to get his wishes. Our spiritual counselor had multiple sessions with him, which were so meaningful for him because he was experiencing a lot of existential pain. I think towards the end, he was able to connect with some of his children. On a somewhat positive note, he forgave everybody whom he had some resentments for. He came to terms with his illness. And I think we were able to get him comfortable. He had a nice, comfortable space. He wasn't alone, I think, more importantly. And a lot of that fear was sort of alleviated. But when he did pass away, I was able to connect with his daughter from England, who for years and years and years, they had been estranged because he had also remarried and the family here was not sharing information with his family back in England or his daughter in England. So I was able to give her the hymns that he had written and talk to her about the beautiful experience of his baptism. And I think that brought her a lot of peace. And she still calls us and checks in with us to make sure that we're safe during this COVID pandemic. And I feel that patient left us a lot of legacy and learnings, especially for really what we're here for, and that we're in fact becoming their family when they do transition to us, especially if they feel alone, lost, abandoned, neglected. We legitimately are that for them. And we go that extra mile to give them, to advocate for dignified burial if there isn't that person to do that for them, and bring them peace and help them, whether it be come to forgiveness, whatever it means to bring them peace to themselves. We have a whole team of amazing, not only clinicians, therapists, volunteers, and support in general, and love to give that to our people. And I think that's the most meaningful. I think that's why this pandemic, we can evolve any situation with any patient to bring some form of positive that we can get through this pandemic with them as well. And so I think I'm just very grateful to be able to share one of many, many stories of impact that this program has allowed us to do.
Felicia, thank you so very much. And I want to ask you if you have the time to join us. We will send you the link at the, what is it now? Whatever time is now. I believe today we have, sorry?
Almost
10 to 3.
10 to 3. At 3 p.m., Felicia, we are moving into a Take Your MPP to Work with Andrea Orbath to visit Chia. This is the inner city, the two sites that Christine Elliott and John Tory and Inner City Toronto and Doctors Without Frontiers and RNO, that we opened 200 beds, 400 beds for people that experience homelessness, that are either waiting for the results of COVID test or that are COVID positive.
Right.
We wanted to also open a third site, Mitzie, that was with inclusive of ventilators and palliative care all in there, because some of us were uncomfortable with transferring some of these persons to hospital care, because that's not, you know, it's not the usual care that the nurses, through via Nurse Shirley, 100 nurses we sent to work there. In fact, Imagine is now back for a couple of months because the director of policy, who is Matt Calway, was seconded to work with them to help make all this happen. So that's Dr. Andrew Bond and Lee Chapman, who you, I'm sure, know of. She is the clinical leader for this. It will be wonderful that you join, and more wonderful even, Shirley, that we make connections after.
For sure.
Some of these programs.
Yeah.
And the other piece that occurred to me, we have done a lot with long-term care in terms of, Imagine, the bi-weekly webinars that we do about long-term care because of the disastrous situation, basically, that they found themselves. So we do with nurse practitioners. We need to start to do no more than once a week, simply because we don't have more energy left, to tell you the truth, or even once every 2 weeks. Focus on home care and take echo, and take aspects of your book. This will be for all the home care agencies. It just occurred to me because of this opportunity to hear to the awesome work and to see how we take echo forward in all its possible dimensions related to home care.
Yeah.
Because we got to refocus the system. It's urgent.
Yeah, probably the most important takeaway message is that probably in the next 12 to 24 months, if we don't get the community working, we don't get where people live and age, and allow them to have the right kind of home care services that are, the words I've been using is now more customized and personalized in this pandemic. And sort of this transactional model of care per hour, per visit, is not going to work in this environment.
But not even the pandemic. We had to refocus the whole system.
Very true. Very true.
The only silver lining of this pandemic, two silver linings. One you guys mentioned, the ability that we have to work in a very different way than before with so many stakeholders that we never did before. And it started a bit with the OHTs, but the pandemic just accelerated it. Yep. The second silver lining is to totally recalibrate the system to primary care, home care, nursing homes seen as the homes of people, not as this isolated piece. So really, all the eco components, recalibrating the system. If we don't succeed now, the game is over. And we need to succeed because the public needs that.
Absolutely.
It's the public needs that. With COVID or without COVID, the time is over to only anchor a system in hospital care. We quoted Angela in the report with a sentence that she tweeted one time, very clear. Most people live in the community. They do not live, nor do they want to live in a hospital. So of course we need strong hospitals and robust hospitals when they are needed. We need to recalibrate and anchor the system in community care. It's desperate.
It's very true. And I think it's been over 20 years where we're trying to look at different funding.
Exactly.
We're trying to also have the frontline nurse that really has the education and the responsibility and the autonomy to work with clients and families. And honestly, it's been the ECHO report, and I would say very few other initiatives that have helped reinforce what home care providers for literally, St. Eliz, it's been 110 years. We've been trying to get change to happen. And either the funding model, the delivery model, the business model, all sorts of things complicated, not being under the Canada Health Act, you name it, everything falls into that. And you're absolutely right, Doris. Now is the time where we can turn the page and actually, when we talk about person and family-centered care, who would not think that the start of that is where people live their lives?
Mhm.
So let's get the kind of customization and care for people and their families in their communities that'll work. And that's why I can't underscore the recommendations with ECHO for the home care piece are so accurate and correct, where it really is about different funding, more flexibility for real patient-focused care and real customization of what people need. And let's stop worrying about how many hours of care they got or what the nurse did. Let's worry about, are they able to live and die at home in the most wonderful way?
Yeah.
That is
Surely,
the way.
that's
Kyle,
a great
Kyle,
note to end on.
Yeah, Kyle, please send the link to Felicia so she can join that meeting, please.
Absolutely will do.
Yeah. Okay. Listen, thank
You guys shine.
all.
You guys
really
do. Shine. You really do.
Yeah,
And
you
always
really
have.
do.
You always have.
Thank
Go
you,
sign the lead.
Mitzie, for joining us.
Oh,
Thank
no,
you,
no,
Mitzie.
thank you. It was my honor to be here. And I really want to say that Kyan and Jill and Felicia, you just are gems.
Stars.
You're
Stars.
gems, and we are so lucky to have you in the system of care in Ontario, and the personal way that you do your work is phenomenal. I just think your hearts are just so big, and I just really want to say thank you, and for the leadership that SC Health is showing as a social enterprise. I have a lot of respect for social enterprises. I worked for Goodwill for 7 years.
Yeah.
And it's an incredible model. And so just thank you. My 2 words I wrote down, nurses stand for comfort and care. And
knowledge and expertise, I would add.
Yes, and well, for sure.
I would add compassion. She made me cry.
And courage.
I know.
My gosh, we will not put enough words.
And I would say we're just so cute as can be.
Right?
Oh, of course.
Especially with our hair.
On the sea.
Oh, thank you, everyone. And so we'll now go to the next session, which
Thank you, Saint Elise. Thank you.
Yes,
Thank you, Shirley.
the future.
Bye-bye.